Hello, my name is Bryna Block. I'm with the San Diego Center for AIDS Research. And today we have the honor of talking with Dr. Jaime Arredondo Sanchez Lira, apologies for any mispronunciations, who has been involved with at least two of our international pilot studies. Okay, Dr. Arredondo is currently the Canada Research Chair on Substance Use and Health Systems. He is a scientist at the Canadian Institute for Substance Use Research. He is also an assistant professor at the School of Public Health and Social Policy at the University of Victoria, British Columbia, Canada. And Dr. Arredondo, would you tell us please about the two projects that you have worked on so far?
Thank you, Ryan. Yes. Hi, everybody. Thank you for your time. So throughout my years working with the UCSD, I've been involved in a lot of projects, but two that have been financed by CFAR International Pilot Grants. The first one was the Tijuana Police Assessment, or the Foundation for Structural HIV Prevention. And this was an international pilot between Dr. Carlos Magis in Mexico City at UNAM and Professor Leo Beletsky at UCSD. I was working with them during my time as a PhD student in San Diego, and this work was fundamental to implement what was later going to be an innovative training of police education and occupational safety in the city of Tijuana. With this small grant, what we were able to do is then lobby with other international funders to continue the project, and then successfully, with the help of Dr. Stephanie Stradley, create NIDA grant that allow us to implement and also evaluate this international project in the city of Tijuana. We were able to train almost the entire police of Tijuana, almost 1,800 police officers with our grant. And it was all thanks to this foundational pilot grant. The second that I was able to collaborate, it was already as a professor of drug policy in Mexico after my PhD student studies. And this was the work around assessing fentanyl and HIV among people who inject drugs in the city of Tijuana, Mexico. As some of you might know, fentanyl is a drug that has made its way to the legal drug markets of North America. We didn't have an evidence about whether it was present in the northern part of Mexico. So with this grant, with the other collaborator from UCSD, also Leo Beletsky, and other collaborators like Joseph and Philippe Bourgois from UCLA, we were able to get this funding to try to understand the composition of the local drug supply in the city of Tijuana. And we were able to do more than 600 fentanyl testing strips on use paraphernalia for people who inject drugs in the city. And we were able to establish the presence of fentanyl between almost 85% to almost 0%, depending on where we were distributing supplies. This was also a grant that it was done with the collaboration of a local organization, Preven Casa, who was kind enough to help us join forces to try to understand the risk for people who inject drugs due to overdose of fentanyl in the streets of the city. We are currently closing the study, and it has led to interesting things like the second step that I will talk a little bit more in the future slide. So how have I used the grants results to public papers and apply for other grants? Yes, so as I was explaining in the first grant that I was able to just participate as a research assistant, help us to build into an even bigger grant that it was NIDA funded, but I will focus maybe more on the pilot grant that I have now the honor to be principal investigator. So through this research, we were able to identify several things. One is that fentanyl is present in the local supply, and this was the first time that it was assessed by any study. And also, he gave us what I think is most important, a way to try to then understand other phenomenon. And currently, we are using that pilot grant to trying to understand what is happening, not in the opiates market, but in the stimulants market. So right now we are conducting similar strategies of testing in now 3 different cities in Mexico, both in Tijuana, in Aguascalientes, and in Mexico City, to detect fentanyl in cocaine and methamphetamine. And we also are happy to say that this is the first time that this will be done in Mexico. So there's also another way that we are hoping to use the data is to create some knowledge translation documents. And that means how to give back to the community the information that we have acquired from the studies. And this is being developed into materials about how to detect an overdose, how to prevent it, and also trying to find ways for people to use safely because they're right now, they don't know what they're consuming because the supply is so irregular. So these are the ways that I have used these grants in order to create more research opportunities with our organizations. What advice can I have for new applicants? Well, one will be to choose wisely your collaborators. I think on my part, I have been lucky to find someone like Leo Beletsky, who since my beginnings as a first master's student, then as a PhD student, have always been interested in trying to understand and apply new harm reduction interventions into the global south. So I think that will be one of the first advices, to look really well for the person who you're going to be collaborating on the other side of the border. My second advice would be to talk more to perhaps the people who are in charge of disbursing the funds. I think that for many of us, sometimes it's a new process that local organizations like NGOs, who I have the privilege to work with, are not always well accustomed to. So it is always helpful to look ahead of time to see what institutional barriers there might be, such as the creation of IRBs or international bank accounts, so there can be a smooth transition of funds and on materials between the two sides of the border. And finally, I would advise you all to try to look for innovative ideas. I think that given the shortage of funds for international research in our countries of origin, it's always interesting to look CFAR and other international funding organizations from universities as an opportunity to be able to conduct that on the edge research that sometimes is not being funded by our local institutions or our local countries.